Hi, my name is Megan. I'm the Orthopedic Care Manager at Genesis HealthCare, and today we're going to show you a demonstration on how to remove your post-op dressing for knees, post-op day 1. We're going to show you how to put on a TED hose, and then we're also going to show you how to take off your Aquacell and kind of describe incision care to you. Now what we're going to do here is for knees, now you would take this dressing off the day after surgery, probably in the morning, okay? Now hips, you won't have anything like this, you'll just have the Aquacell, and we'll show you that here in just a second. Now what I'm going to do is I'm going to go ahead and unwrap this just to show you. It's very easy, not hard at all. This is the H wrap. You kind of want to roll it like this. And it just unravels. Now you will notice that you'll have an Iceman kind of in this. It's okay. All you got to do is just replug it in. Now I would keep this because you never know when you might need it, okay? And then this is just cotton material. You just pull it with your hands. Again, really, really easy to come off. You might notice that your skin looks a little orange after surgery, and that's just from what they use to help clean it with the antiseptic. That'll go away with showering. And then I would just throw this away, and then you've got your nice Aquacell here, okay? Now this right here, you can see that there's a little bit, I don't know if you can see that up top there, there's a little bit of bubbling right there. Now that, if you see that, you'd want to be careful about showering, okay? Now typically with these dressings, as long as it's occlusive on all sides and you don't think water can get down in that, you can shower the next day after surgery, so when you get home. Now if there is this little rippling and you think water can get in here and get trapped, you would not want to shower, you'd want to sponge bathe, okay? The other thing that you could do to protect yourself is you could wrap your knee with saran wrap, just for showering, okay, and then take it off, and that will help kind of seal that in if you can only shower. Now no tub soaking at all. That won't be until about 3 weeks after surgery, so you don't want to do that. Obviously water would get up in there. Okay, so what we're going to do here, I'm going to show you the easiest way to get the TED hose on. Now for knees, you're going to have TED hose just on the other side of the knee, just on this one. This one's not going to be on because the dressing will actually be clear down to your ankles. So you're going to want to put on your TED hose. Make sure you leave the hospital with the extra pair. Now hips, you're going to come home, you're just going to have the Aquacell dressing that you can see on your hip, and then you're going to have both your TED hose on. So you can kind of skip this for now. So you just put the little Ziploc bag in. I use like the bigger ones just so I can get around that heel. And then this is your TED hose. You're gonna have 2 of these. If they do get dirty or something gets on them, then you would wanna make sure that you don't stick them in a washing machine or anything like that. You wanna just hand soak them, let them air dry, okay? You can also use compression socks if you already have those at home. And then what you do, so you're gonna have to help the person putting on these, but then you just pull it up, and it is a little tricky. And then see how that just slides because the Ziploc bag's on there. And then at this point, if you want to, you can help the person that's doing it, or whichever, but it's going to be hard for you to do this by yourself, especially right after surgery. Okay, and then as you can see, it's okay that it goes above your dressing there, okay? That's not going to hurt anything. You just want to make sure that it's nice and tight. And then when you're all done, you can pull the Ziploc bag out from the toes, just like that. Okay, so that's why you want to have that Ziploc bag. Everybody has those usually. So right here is the spot that you want to look out for. This is right at the ankle, and this is where you would most likely see it, where it starts to bunch up a little bit. That happens all the time. You want to keep a close eye on this because it can cause a sore development. Now you don't want to sore because that will be an open area and a source of infection for this new knee or hip, okay? So you want to make sure you pull it up or you pull it down a little bit to get rid of that. And you can pull this under your foot, whichever is comfortable for you, okay? Now you do want to make sure you wear supportive shoes when you're wearing your TED hose or socks because these are very slick, okay? So don't just walk around the house with these on. Now these are to be worn for 2 weeks total, okay? Until you come back to see us. And then you want to take them off at bedtime just to let your skin breathe, and then also for showering, and then any other time they need to be back on, okay? So make sure you get those Ziploc bags. Now the day 7 after surgery, and this is for knees and hips, you want to take this Aquacel dressing off, okay? So I'm going to go ahead and do that. You just pull down on this if you have it on. And then, now this is a little sticky, so you can use water if you need to. But it just pulls off, okay? Just like a Band-Aid. And sometimes if you push against the skin like this, then you pull, it feels a little bit better. Now on this right here, this kind of has like a little gel once water is introduced to it or blood, you know, whatever is on there. Now it will kind of gel any drainage that might come off of this. You will notice it'll look a little goopy. What you want to do is just make sure it's not bright red, there's no active bleeding going on. You will probably notice old drainage and it'll look kind of brown. Okay, that is normal. You might even notice some clear drainage or something that has a little bit of a, you know, a yellowish tinge to it, just very light, okay? If you notice bright drainage, bright red, like active bleeding, or if you notice that it's like yellow, dark yellow, green, it has an odor, seems like the drainage is intensifying, you're all of a sudden having increased pain when it started to feel better, you'd want to call us and let us know, okay? Now after we take everything off at that 7th day, you want to take a good look at the staples here. They should all look pretty and beautiful like this. Maybe not this pretty, but you know. Now, as long as there's no open areas or anything like that, you're good. I'd leave it open to air. You can continue to shower, actually. Just use soap and water. Don't use anything else. And then just pat it dry because the staples will be a little tender. Now you'll have a little bit of pinkness. You might even notice that there's some swelling. That is very common, even months after surgery with the swelling. So just make sure you have your leg elevated after surgery and you're icing it with your Iceman or your ice bags. You should put on ice about 20 minutes out of every hour, and that's pretty religiously after surgery to help with the swelling. The other thing is you want your leg way up in the air, okay? I'm talking like if she's laying on a couch right here, you want your leg way up here, 3 to 4 pillows or so, okay? You don't want it just barely off the bed or on the couch. That's just to help reduce the swelling. You will notice swelling in here, in the ankle, and the foot. That is also normal. The more dependent your leg is, where it's laying down like this and not up, the more the swelling will follow gravity and go downward, okay? So that's the importance of bringing it up. And then you would just pull this back up like that. And it's okay if it's touching the incision a little bit, that's fine. You can even roll it like that if you want to, okay? Now, if you do get to a point where you take this off and say you notice there's active drainage coming from it all of a sudden, we'd want to make sure you covered it with something, a dressing of some sort. You can get it from any pharmacy, but this is gauze. You can get it in a boat like this, and these are just little gauze, okay? They're just little 4x4s. And then you would put it right here, just like that, just to kind of catch that drainage if there is any. You would also want to make sure you called us so that we were aware of it, especially if it's, you know, got any of that bright red drainage, that weird odor kind of drainage or anything like that. And then this is also an Abd Pad or a 5x9 dressing, okay? Some people will only use this, especially if you don't have much drainage, and then you just put that on there if you're having a lot. And then you can use that ACE wrap that we had before, and you can wrap this so it holds it in place. And if you have any questions or concerns during any of this, feel free to call me. You can call the office number, and there's also a nurse line. You'll get that on your paperwork when you discharge the hospital. You can call them anytime, middle of the night, weekends, holidays, anything like that. And we can get in touch with your physician if need be, or they can get a hold of you and let you know what to do.